Hello, my name is Gideon Bletcher. I'm a urologist from Melbourne, Australia, and today we're going to be briefly discussing Peyronie's disease. By the time patients come and see their primary care physician, it can often be some time they've been dealing with Peyronie's disease, and it really is a fairly devastating disease for many patients. It takes quite a lot for these patients to come and see the GP in the first place. So I think the really important thing to be aware of is the fact that it exists, and to not brush the patient off and say, there, it'll be okay, because sometimes these patients' lives are really turned upside down. Peyronie's disease is an acquired form of penile scarring, and it's often idiopathic. We have no idea why it occurs, although sometimes there's a correlation between patients who have certain injuries such as plantar fasciitis or Dupuytren's contracture. They're more likely, 25% of which will develop Peyronie's disease. Sometimes the curvature or scarring can occur post some form of penile trauma as well. It's divided into two main phases. There's an acute phase, which lasts somewhere between 6 months and sometimes even up to 18 months, and it's characterized by painful erections. And there's progressive changes of the penis. It becomes shorter sometimes it becomes curved. Sometimes there's other deformities which are quite unusual, leading to some sort of instability. Erectile dysfunction can also result. And this lasts, as I said, for that period of time, after which the changes seem to settle. And at that stage, the penis is often very different to how it was in the beginning, although a small number of patients, maybe up to 10%, during that acute phase may actually return more back to their baseline or not as severe as what their changes had been. So the treatment in the acute phase really is about pain management. It's often about anti-inflammatories, simple analgesics. There's a small role for other treatments such as low-intensity shockwave treatment. But really, there should be no definitive treatments performed at this stage until the changes have become stable. So after 3 to 6 months of no changes and the penis is no longer painful when it is erect, that's when you know that they're out of the acute phase and in the chronic phase. The treatments for the chronic phase, there are several, ranging from fairly conservative options such as a traction or a vacuum device, which have some limited evidence and a small amount of an ability to improve a curve. Then there's some form of injections, and there's been several throughout the years, but the most recent and probably most effective is that of collagenase, which helps to try and break down the scar which is built up within the tunica albuginea of the penis. That scar is not stretchable, therefore that's why we get the curves. So when we inject the collagenase, that helps to break up the scar, hence trying to improve the curvature deformities. The next treatment really is that of surgery, and there are 3 main kinds of surgeries depending on the degree of the curvature, the length of the penis, the patient preference, surgeon preference, as well as the quality of the erections. Because as well as addressing the curve or deformities, we have to be mindful that these men need treatment for their erectile dysfunction as well. So the 3 treatments in terms of surgeries are either some form of plication operation. And plication is simply putting sutures in to try and shorten one of the sides of the penis. And that's going to be the longer convex side of the penis that we shorten. The downside of this is obviously going to shorten the penis, and there's a small risk of erectile dysfunction and some other potential adverse outcomes. The next treatment option, slightly more invasive, is a plaque incision and grafting, which essentially involves cutting one side of the shaft of the penis and placing some sort of a graft material in there to cover the defect of the tunica albuginea, thereby lengthening the penis. Although many men with this operation will still get a degree of shortening, the risk of erectile dysfunction is significantly higher with this operation as well. So it really is reserved for those who either have a very short length of penis to start with, very severe curves, and those with pretty good erectile function. The final treatment option is using a penile implant to address both the erectile dysfunction and the curve. And this can be used quite successfully using either a malleable or an inflatable penile implant. The final treatment or management really for Peyronie's disease is involving a psychosexual counselor. These patients often find that their worlds implode, their confidence decreases, depression is an issue, their ability to form or maintain relationships and have good quality sex lives really does deteriorate. So again, it's a holistic approach for the management of patients with Peyronie's disease. Thank you for your time, and for more information, please head to the ISSM website.